evening and welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Scheme and the health insurance space at large. The past 3.5 years have been filled with tremendous breakthroughs for the NHIA, continuous efforts by the present leadership to put the authority on the right trajectory cannot be overemphasized. In this episode, we'll bring you a brief interview with Professor Mohammed Nasir Sambo, Director General NHIA, where he gives an update on the efforts put in place to increase health insurance coverage and to put the authority on a path towards fulfilling its mandates. I am Aisha Mohammed Ahmed, your regular anchor. Stay tuned for the full program coming your way after the break.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, Professor Sambo calls on staff to be good ambassadors, just as NBA calls for support for the NHIA.
The Director General, National Health Insurance Authority, Professor Mohammed Nasir Sambo, has called on staff of the organization to be good ambassadors. The DG was speaking at a meeting held with members of staff at its headquarters on Monday, November 28, 2022, as the authority is working towards its forthcoming health insurance summit.
So that the way...
Speaking further, Professor Sambo said the authority has enjoyed tremendous growth, so the summit will be a golden opportunity for the NHIA and will help the authority showcase itself for support.
We have been able to push forward and we have reached this level that we are trying to showcase what we are doing. Therefore, we want every staff of the organization to be a good ambassador to this organization. This summit is a rare privilege. It's a rare privilege. In fact, some organizations, they don't even have the courage or something to go and bring Mr. President to lunch. But we have tried to package. I want us to be committed, to be good ambassadors in terms of disseminating information, in terms of getting people to know about this summit, in terms of people to understand the content of the summit, in terms of educating and enlightening people about the aftermath of the summit. What is the summit is all about? What does the summit wants to achieve, and so on and so forth.
That he gave to us to serve.
The President, Nigerian Bar Association, Yakubu Chonoko Michael, SAN, has called on President Buhari to support the National Health Insurance Authority in its quest towards the attainment of universal health coverage. Michael stated this in an interview when he paid a visit to the headquarters of the National Health Insurance Authority in Abuja.
Of the purpose of the legislation.
Speaking further, he added that additional funding will enable the authority fulfill its mandate to Nigerians. Michael said the NBA is delighted to be part of the NHIA and will align itself with its objectives, especially the economic benefits of all Nigerians having access to health care.
So if there is a need for the interpretation of any provision of the law, NBA, like I said, is prepared to either take it up on the authority of this authority, the National Health Insurance Authority, or support whatever effort that the authority would do in order to get clarity in any of the provisions of the legislation that appears hazy or that appears to have multiple interpretations, just so that the court can put clarity to it. And then it's also going to be part of the implementation process. That is why I'm so grateful to the Director General in finding us worthy to participate in the processes of the implementation of this law. And in whatever way we can contribute to support the process of the implementation, we are prepared to do it, we are available to do it, and we'll do everything possible to make sure that the legislation succeeds. This authority also succeeds in the task that is given to it by this legislation.
Welcome back. The mission of the NHIA is to mobilize and pool financial resources in order to purchase affordable and quality health care for all Nigerians. In this episode, we'll hear from Professor Mohammed Nasir Sambo, DG NHIA, where he gives an update on the journey so far and efforts put together by the authority to expand coverage. Let us hear him in our next segment, Issues Around the NHIA. Keep watching.
The National Health Insurance Scheme was created in 1999 by the federal government to bring quality and affordable healthcare to Nigerians. The scheme started running in 2006 with civil servants in the employment of the federal government enrolled into the formal sector health insurance program, accessing healthcare for themselves, a spouse, and 4 biological children under the age of 18. The scheme, however, struggled with increasing its reach beyond the formal sector with various other health insurance programs to cater for the informal sector. Very minimal success was achieved as the NHIA battled with internal wrangling between management and staff. There was also a general lack of coordination between the federal and state offices. In July 2019, Professor Nasir Sambo was appointed as the Chief Executive Officer of the NHIS, who has been described as a round peg in a round hole. Soon after his appointment, he embarked on a number of reforms, advocacy, trainings to reposition the NHIS for efficiency. In May 2022, the NHIS received a boost when the much-awaited Amended Act was signed into law, remaining the scheme as the National Health Insurance Authority and making healthcare mandatory for all Nigerians.
We continue to
Speaking in a recent interview, Professor Mohammed Nasir Sambo, as Director General of the NHIA, explains more on their operations.
The activities of NHIA is concerned for all, whether you are rich or poor. If you are rich and you feel that you have sufficient resources to have healthcare arrangement anytime, but just remember that in your own village there could be relatives of yours that are very close to you that are having challenges in obtaining healthcare or having access to healthcare services. The NHIS is created to ensure that those people that have difficulty are brought on board to have a very good healthcare services and ultimately have a productive life.
Looking back from when he assumed office, Professor Sambo explained the journey so far and measures put in place by the authority to expand coverage.
And when we came, we x-rayed the ecosystem and we realized that there are so many problems. And apart from x-raying the situation, the report of the presidential panel has underscored a lot of problems about 10 key problematic areas that we were given to quickly address. So our first year was dedicated to ensure that we brought in stability into the organization.
The 3-point rebranding agenda of Professor Mohammed Nasir Sambo is seen as a pillar that has helped reshape the operations of the authority.
We embark on what we call rebranding agenda of the organization, which was anchored on 3 pillars. One, restoring value system that will make the organization credible and result-oriented. Second, how to engendering transparency and accountability in the entire operation of the organization. And third, to accelerate the drive towards attainment of universal health coverage. We felt that rebranding effort is very, very key to, one, be able to stabilize the organization, number two, to be able to reform the organization, and number three, to refocus the organization for better performance.
Professor Sambo's three-point rebranding agenda was a move in the right direction, given that it has contributed significantly in putting the authority on the right path. It touches on every operation of the authority.
We went straight into deconstructing the pillars into various elements. Like if you look at the element, the first pillar has about 3 elements that has to do with creating a very good and working enabling environment, ensuring discipline within the organization, and creating mutual respect and harmony, and ensuring that equity is engendered in the process of managing the organization. And we step in to implement all those elements that we have identified as key for stabilizing the organization. That is why this organization that has been notorious in terms of crisis has now been fully transformed. You don't hear any crisis within the organization. Neither do you hear any heard of any crisis outside the organization. So with respect to the transparency and accountability, we have worked very closely with all the stakeholders in the health insurance ecosystem, and we have consistently embarked on the process of informing, educating, and enlightening people so that they know what the health insurance is all about, what is their roles and responsibility, and so on and so forth.
The DG further explains the operations of the NHIA programs and its modifications that will increase coverage of Nigerians.
In expanding the fiscal space, we have pursued it in two-pronged approach, which is in line with the third pillar of the rebranding. One, we try to consolidate the existing programs that are there, programs for the formal sector, programs for the employees of the formal sector, and employees of the federal sector. There were a lot of bottlenecks in the implementation of these programs, so we tried to look at those bottlenecks with a view to finding how to resolve them. And we have gone far in trying to address most of the key critical issues that are affecting the smooth operation of that system.
Professor Sambo explains more on the innovative program that is bringing succor to the vulnerable.
And the second perspective is the issue that has to do with innovation. We have created a lot of innovations that is aimed to expanding the fiscal space. One of the things that we have done, even though we made it on ground but not being implemented, is the issue of basic healthcare provision fund. This is a system. This is a creation of the National Health Act, this Basic Healthcare Provision Fund, creation of the National Health Act that has given healthcare delivery system opportunity to have 1% of its consolidated revenue, and out of which about 50% is coming to the National Health Insurance Authority, and we in turn distribute it to the states, because states have their state health insurance agencies so that they can cover the vulnerable segment of the population. By vulnerable, we are talking about the poor, the women with a reproductive age, and the children under 5, people with disability, and other people that are in disadvantageous positions. So this is what the basic healthcare provision is aimed to achieve. And if you go to almost all the states apart from Rivers and Akwa Ibom, you realize that a lot of vulnerable people are benefiting already from the program.
He speaks further
We have also created what we call Group, Individual and Family Social Health Insurance Program, GIFSHIP. About 1.5 years ago, Honorable Minister of Health launched that program. That program is intended to bring the informal sector. If you look at the informal sector segment of the population, I mean those people that are self-employed, those people that are working in an organization that has less than 5 workers, they constitute majority, the bulk of the population.
Significantly, a move that seeks to expand coverage for the NHIA is the Vulnerable Group Fund in the new NHIA Act. Professor Sambo explains his optimism.
The most important issue that we have done in expanding the fiscal space is to ensure that we have changed the law establishing the National Health Insurance scheme to what we now have as National Health Insurance Authority. The most important aspect of that law is that it makes a provision of what we call vulnerable group funds. And these vulnerable group funds, it is intended to take responsibility of about 83 million poor Nigerians that have no financial access to the healthcare system. So with the signing of this law, health insurance is now made mandatory, irrespective of where you are, and you have ability to pay. You must come to the National Health Insurance System. If you are not gainfully employed to the extent that you can pay for the health insurance services, we are by this vulnerable group fund, you will have opportunity to be covered.
Welcome back. Mr. Aberaran Adelaja is the Zonal Coordinator, North Central Zone A. It comprises Niger, Kogi, and Kwara states. As someone who has grown through the ranks in the National Health Insurance Authority, Mr. Adelaja has a lot to say about health insurance. Our discussion with him as a stakeholder in the implementation of the NHIA centered around North Central A. He starts with an assessment of the healthcare delivery in the zone.
Well, in the North Central A zone, covering Kwara, Kogi, and Niger, I think the states are doing well and assessing across our various programs. If you look at the Basic Healthcare Provision Fund, the NHIS is collaborating with the state social health insurance agencies, and we are doing quite well. They have done accreditation of primary health care facilities, and then access to care has started, at least in most of the places, and the enrollment is also good, and the response is from the field, because recently I undertook a monitoring and evaluation of some of those facilities under the Basic Healthcare Provision Fund, and the responses that we're getting from the field is quite good. The NHIS Gateway is working and working quite well. At the level of the other programs, the formal sector programs, we're also doing well. We have done quality assurance in a number of the facilities. We have also done reaccreditation of some facilities in the zone. And one of the things that we're also doing is to engage with the various managements of the various agencies, the facilities rather, so that we know what are the challenges and then to provide solution. In fact, in one of the teaching hospitals in the zone, we had to undertake a training for everybody who was involved in the NHIS clinic, and the results are quite good.
Mr. Adelaja explains the peculiarities of his zone and the significant efforts put in place to reach even the suburbs of his terrain.
Kwara, Kogi, and Niger unfortunately do not have the best of road networks. But I know a lot of improvements are happening in recent times. Niger, some security challenges in some local governments. Some of the areas in Kwara and also Kogi are also flashpoints. But basically, we have tried within the limits of what is possible to try and get to the rural areas, because that's where we have the population. And what we do is to work with some agencies to know what is happening. We work with information. We collaborate with the local communities, and they're able to guide us around. And we are reaching quite a lot.
Bearing in mind that the North Central also has a large informal sector population, Mr. Adelaja says efforts are being put in place to attain coverage.
We are working with the state social health insurance agencies. Not too long ago, we had this forum where we discussed the concept of health insurance under one roof, which was introduced by our current Executive Secretary, Prof Mohammed Sambo, and as a matrix of cover. The idea is that there are areas where the states can move in, and then we allow them to move in. And there are areas where we come in, we also come in. But essentially, we are improving on communication and marketing. Recently, in Lokoja, we pulled people from the various states under the zone to do a training on communication and marketing strategy for gift ship. That has to do with issues of messaging, issues of approaches and all of that. And that's one way that we are trying to speak with people outside of the formal sector, because like we said, gift ship is formalizing the informal sector, and that has quite a number of people. We can target individuals, we are targeting groups and families. We are also engaging with the media. We have a number of activities that we do with the various media organizations to help us propel the message of health insurance.
The new NHIA flagship program, Gift Ship, is gaining acceptance within the zone, but however, not without a few challenges. Mr. Adelaja speaks on it.
It's recent, and then we have done quite a number of enrollments, but the challenge also has been that people need to understand it more, because we had a program before, which is Visit Ship, and Gift Ship is an improvement on on Visit Ship. So the idea now is that people need to, that transition is a bit challenging, but again, with information, we are making progress. The idea is that people can see that this is better for the entire system, because this provides for a larger pool to be able to provide services.
That was Mr. Aberaran Adelaja, North Central A Zonal Coordinator, speaking on various issues around the zone. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: does this NHIS have an avenue for complaint?
There are avenues for complaints. We have our call centers, we have our state offices, and we also have some of our major program departments that look after complaints like enforcement, standards and quality assurance, and formal sector.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
This is all we can take on our episode today. Join us for another interesting episode again, same time and on this same station, as we continue to bring you more stories of happenings around the NHIA and the health insurance ecosystem at large. But if you do have inquiries or comments, send them to any of our feedback channels showing on your screen, or call any of the NHIA helplines at the end of the program. Enjoy the rest of the evening.